Hi, I'm Dr. Craig Castanet in Decatur, Georgia. I'm going to talk to you today about a very common problem. It's neck pain and shoulder blade pain. Sometimes you'll feel it between the shoulder blades as well. Sometimes if it involves a pinched nerve, it'll go down the arm, tingling, numbness, and pain. It can be incapacitating, or it can just be nagging and a real problem in terms of your quality of life. It's treated most effectively by getting pressure off of the pain generator. And like the rest of the spine, the three pain generators that are common in the neck are the disc, the joint, and the nerve. If you get pressure off of those, you will get the patient better like 98% of the time. And the way you do that is, and I've used this the last 17 years of my 36 years in practice, is you use a sophisticated traction table called spinal decompression. You secure the patient comfortably in the machine. The machine gently tractions. It gets pressure off of the pain generator, whether it's one or all three of those three tissues, the disc, the joint, and the nerve, and the patient gets better. Typically with the first treatment, there'll be improvement. Sometimes the improvement is modest, sometimes very surprisingly significant for the patient. And it's important to get a response as soon as possible, because you are testing your diagnosis with treatment to see if in fact you're correct and the response to treatment affirms your diagnosis. But it's very simple once you have a great tool like this. I've seen these things get better just consistently. It's much more effective than the treatment I used when I was in orthopedics, physical medicine, and physical therapy. And the reason is that these are compressive lesions. They are by their nature compressive. And if you don't do anything to reverse or mitigate the compression, you're not going to get better. That's an absolute necessity. And so that means decompressing the person. You can use crude means of traction devices, and many therapists have access to crude means of traction devices, but they don't do a very good job, so therapists often lose their enthusiasm for them, and certainly the patient does also. I sometimes get patients that have seen other practitioners. In fact, I typically do. And many of them have had traction elsewhere, and the traction was done half-heartedly with a lousy machine for too little time with a practitioner that wasn't enthusiastic. And yet the patient will come to me and say, yeah, the treatment helped somewhat, and the most effective part was the traction. Yeah, not surprising. These are compressive lesions. In fact, compression is the cause of most neck and back pain. The specific lesion varies from person to person, and if you read an MRI scan, you'll see a host of descriptions of lesions in the spine. But the point is that as a whole, they are compressive in nature, and decompressing the spine is the most effective means of treatment. If you do that, people get better faster and stay better longer than any of the means of treatment I've used in 36 years of practice. I'm Dr. Craig Castanet in Decatur, Georgia. If I can help you with your neck and shoulder pain, call me at 404-558-4015. If you'd like to learn more, you can go to my website, backstrong.net, and from there you can go to my YouTube channel where you can see a host of videos on a variety of topics related to neck and back pain. Thanks very much. Bye-bye.